We all know way too well that CRPS is a condition involving so many different aspects of a person's life. Today we would like to talk about the psychological part of CRPS. CRPS is a condition that, amongst many other symptoms, manifests through extreme pain. Usually, the triggering event is a trauma that never heals, showing a disproportionate amount of pain. This condition is very difficult to diagnose, and there are many cases of misdiagnosis, which is a subject we will touch in a future video. The diagnosis is usually done by ruling out any other possibilities. This means many doctors might only consider the situation psychological. How many patients have been told this is only in your head? Here, we have our first question. Is CRPS a psychological disorder?
So of course, CRPS is not a psychological condition. The pain is real and the inflammatory reaction that usually comes with it is real. It is true that some patients have shown anxiety or depression prior to this condition, so it might be connected. Also, simple stressful moments might help a lot into developing of this condition. So a psychological side is real and it's important, but the condition is not psychological. In Italy, is considered a rheumatological condition, and of course, with the pain, there are many psychological issues that might occur.
So what are the psychological effects of CRPS?
Well, CRPS, of course, as I said before, comes with extreme pain. So the psychological effects of extreme pain, especially when it's something that is going on for a while now, creates a vicious circle into the patient psychology. Many times the patient feels like nobody can help them, so there's a type of negativity going towards the outer world, or many times the patient feels like is useless. So seeing all the struggle that carrying people around him or her might have, trying to help, trying to help her or him. Might feel useless or weak, and then of course there is a negativity towards the future. After a while with pain, a patient does not see the situation improving, and this creates a vicious cycle, which basically is the one that comes with every painful condition, and is pain, anxiety, depression that leads to more pain. So,
okay, do we know of any techniques used to work on these psychological issues that might come with CRPS?
Yes, there are many techniques made to cope with the pain, like the Neridronate rather than a simple physiotherapy or a massage therapy. A good osteopath or therapist will always involve a caring person, maybe a family member or a close friend, because even the people around the patient need to know how to approach this patient, and because in the end, being too attached to the patient is as harmful as not doing anything. So there's certain techniques and exercises that the patient and the caregiver can do together, and improving day by day. It's no easy task.
Do psychological factors have an influence on the patient's recovery?
Yes, absolutely. The power of the mind over the body has been proven for ages to be very strong, and of course there are certain therapies that are pharmaceutical, like for example here in Italy we use Neridronate. Alone they can't solve the problem. There has to be some work done on the patient's side as well, so that's why a rehabilitative program needs to embrace everything from the psychological to the physical, and little by little, doing small steps during daily tasks will improve the situation. The depression will not help because it will make the patient sit still basically and just hoping for a recovery to come out of somewhere. This is not how CRPS works, unfortunately, and there is it's no easy task again, and there's a lot of work to be done on the patient's side as well.
Okay, our last question is related to medicines. So, the drug addiction that comes from the meds, the opioids, or other treatments that are known in other countries, do they have an influence on the patient's psychology?
So drug addiction have a huge effects on the psychology of a patient because, of course, in CRPS, the main symptom is the pain, but solving that problem will not solve everything else that comes with CRPS. So eventually the pain will come back and the drugs will be less and less effective and the person will need more and more of them. So that will push the patient into a situation in which you'll see that nothing is going to help, goes on for years with opioids that might even go on working on the nervous system and might go and worsen the situation. Like many doctors are, for example, sure that the use of these drugs might cause the actual spreading of the condition. So yes, it does have a huge influence on the psychology of the patient, especially since it's only a temporary situation and let's say in a way an easy one because it gives the patient the idea that drugs will solve everything and that there is nothing that the patient itself can do. So again, you'll be in a situation of negativity towards yourself, towards the world, and towards the people that don't understand how they can help you.
Okay, so that's all for our Q&A today. If you have any questions, don't hesitate to write on our website or our Facebook page,
Yeah.
and we'll be happy to help.